All right, if you're just tuning in, this is Real Talk with Kike, and we have a seasoned medical expert in our midst with quality years of career in the healthcare system. He is on the show to bring us to speed on the coronavirus and its incident within Nigeria. We've been discussing the treatment of victims, the prevention measure that ought to be taken, and providing us with vital information on the COVID-19. Please join us by calling the phone lines 0700 923 923 923, again 0700 923 923, or send us a message on 0817 313 6193. So thank you so much again, Dr. Tsuyi, for all the information that you've been sharing with us thus far. So, quickly, can you kindly bring the Nigerians to speed on the actions and measures that have been taken on containing this virus thus far?
Well, again, given our limited resources, given our constraints, given the kind of the broken health system that we are running, we will say kudos to those people that have actually stood up and put the information, especially at the level of quickly containing this virus. But that's where we are, And then, for me, if you ask me, what are you supposed to do? We should be able to act at individual level. That is what can help us to a large extent. Now, we don't want this virus to break into the larger society where we have to be closing school, closing market, preventing church going or religious organization, and cancelling a lot of business concern. We don't want that to happen.
But the question is, do you think that we have the manpower or the know-how on how to effectively stop the spread of this virus? To be honest,
we'll seek help. I have told you, we're trying to look at the epidemic preparedness of Nigeria, and I mentioned fund as one of
when you say you are seeking help, you are seeking help from where? From who are the partners?
Obviously, the development partners are very key in curtailing epidemics. Okay. Because number one, you need kits to test. You need equipment. You need protective equipment. It has to come from the development partner. If you look at your health budget, it's just barely 4%. What is 4%? What is it going to do? Okay. Now you don't have the money, so you have to look for money. Okay. Then two, communication. For me, communication is key, because at the end of the day, you remember during the Ebola, a minister came up and said that they already have vaccine against Ebola when there was no vaccine. Even from a minister. Okay. And then that's a level of government. Somebody came and said that, what? If you bathe with salt and drink salt, you'll be okay. And we lost people. I
agree with you that when it comes to dissemination of information, we have issues in our country today, especially coming from even the federal government itself, and if the people that we are putting in power, so to speak, cannot be accountable when it comes to information dissemination, definitely we have lots of issue in our hands. But, moving forward, because of time, Nigeria in recent times has been battling with Lassa fever, which has become an epidemic virus or disease, so to speak. What is the level of our preparedness, as we've been talking about, on the outbreak of this virus that we are now trying to deal with, knowing that you've mentioned earlier that funds is a key issue and information when it comes to some certain issue is key. I know that in recent time, China, like some of the information that I have read till date, that China they knew about all of this and they could not share the information with us on time. So when it comes to things like that, would you hold accountable? And when it comes to the preparedness of the outbreak of this virus,
government should really be accountable, because like I said, honesty is key. Honesty allows you to know what to do as far as this is concerned. Now, we have to look up to government. We have to do what we can do. As far as we are concerned, the other aspect of epidemic preparedness is human resources. In Nigeria, 30-something thousand doctors for 200 million people. Epidemiologists, how many do we have? How many, lab scientists do we have? Let's be real here, you understand? And then we don't have the requisite human resources. And, we tend to say, it's not my portion. Now, maybe it's going to be your portion, not your portion. The virus itself does not care, about your faith. So now, what we need to do, if government can get hold of the information and direct information appropriately, what we need to do is that take charge of our life. Please don't be in a hurry to leave this earth. Even if you are going to enjoy forever in heaven, stay on earth as long as you can. And what you need to do, simple thing, There's a sanitation aspect, which has to do with your environment, and there's hygiene aspect, which has to do with you.
All right, hold that thought, please. We have a message from Ayobami Okolawon. He said, "Good evening, Real Talk with Kike. At this particular period, good personal hygiene is key, just like you've been emphasizing on. But my question for Dr. Tui is that, is it true that chloroquine is a potent inhibitor of the coronavirus? And is it also true that the African blood is genetically resistant to coronavirus?" Ayobami, be careful.
Ayobami, these are some of the information that government should come out clearly and debunk. Please, chloroquine, African blood, they are not resistant to coronavirus or COVID-19. No. So please don't waste your time to buy chloroquine. Don't waste your time to be cooking ginger or thinking that you have one super blood structure that is going to deal with.
Okay, so talking about ginger, I know that recently I read somewhere saying that when you take warm water and lime or something for a particular age, I'm not sure how true it is, but at least I have an health expert with me in the studio that can share more light on that maybe that might help one to catch the virus, if that's
to fight the virus.
Yes, to fight the virus.
The thing is this, let's face it, we talk about ongoing chronic illnesses or depressed immune system. Nigeria as a country has one of the largest number of malnourished children. We have one of the largest number of HIV, largest number of tuberculosis, and broken health system. We have ongoing epidemics, Lassa fever, meningitis can come sometimes, cholera is hiding somewhere. So we have all these things. All we created was to what we call emergency operation centers at the level of National Center for Disease Control. We can't be running emergency non-stop.
So Dr. Tui, what is the economic implication of this pandemic, so to speak, that we'll be talking about? Can we actually afford to shut down our ports of entry? Because all of this is affecting our economy, whether we like it or not. There's some information that one of the OAP was sharing with us before we went on air regarding some of the issues that we've been facing with some businesses that are trying to shut down and all. Imagine if our airport shuts down today. How can we afford to shut down our ports with this kind of virus?
In fact, even if Inspiration FM will be off air, so don't. They do not
try.
We don't want COVID-19 to enter Inspiration FM, so you'll be working from home. So the simple thing is this: the economic implication is humongous. You know what has happened to China? They can't manufacture. Even a lot of things are having medical supplies. Huge challenges with medical supplies because half of them are being manufactured in China. You can see that the thing has actually entered America. The Fed is cutting interest rate so as to fight depression. Is the world going to go into depression? If you're not careful, most likely, because if you're not manufacturing for 3 months, your growth, even in China, the prediction of 5 to 7% growth has been downgraded. Recently Nigeria, the rating agencies rated Nigeria as B negative. You know what that means? So we have quite a lot of issues. We cannot allow. It is a very fragile economy based on oil. Since if there's no demand for oil, what's happened is that the budget cannot perform. If the budget is not performing, then we're going down.
All right. Thank you so much, Dr. Tui, for joining us in the studio today. And when you spoke about, shutting down, I pray that someday we would pick and work ethics where everybody doesn't have to be in the office environment every day of the week. Hello, in America where I once worked, we don't have to be in the office every day of the week. I pray Nigeria will adopt that work ethic someday. Anyways, because of time, I want to say this is our golden closing adage from Kotsi Omoluabi personality from Goldberg, one of our great sponsors. In fact, I don't want to say they are the highest paid sponsor before they are because anyway, it's called Ìmọ́tótó ló ń borí àrùn, which means the hygiene is the best cover from diseases. In a period when a pandemic has hit us globally, it is important that we maintain top-notch hygiene to prevent spread and curtail the effect of the coronavirus. Together as one nation and one people, we will conquer the dreaded virus. As just like what Dr. Tui once emphasized on, that it takes all of us to work together, not just the government. We cannot leave everything to government. Thank you so much for joining us today. Well, listeners, and to our esteemed doctor and expert on the show, I actually learned a lot of things, and I like the fact that you're extremely on fire. We appreciate you today. Thank you for joining us today. And also to Chioma BBB that wants to, don't let me call you out on national radio.
I love you too.
All right, we'll be back next week, same time, same station, because I'm here. They've held me down. So all other radio stations that have been calling me to come and join them, please, this is my place. All right, be good and be of good hygiene and spread positivity. Stay tuned. We'll be right back next week. Bye for now.